Hello everyone, welcome to my channel Dr. Shil's Physio Victory. Today we will discuss about previous year questions of GSSSB 2016 which are very important in upcoming exams. Let's start. Today's first question is green streak fracture is seen in option A adult, option B children, option C at any age, option D elderly. Here the correct answer is option B children. In children, the organic matrix, that means collagen is very high, but mineral content is low. This makes the bone flexible but not brittle. Next, come to question number 2. A patient with ORIF for left hip fracture on the fifth day post-operative patient PT treatment, patient develops a large ecchymosis of right hip. Most likely, the patient has developed option A, deep vein thrombosis, option B, hematocele, option C, hemangioma, option D, complication of anticoagulant therapy. Here, the correct answer is option D, complication of anticoagulant therapy. Actually, after ORIF, hip fracture patients are routinely given heparin and or warfarin, which are anticoagulant to basically prevent DVT. Which basically increases bleeding tendency and cause subacute hemorrhage or ecchymosis. DVT is basically pain in the calf or tenderness. Hematocele is blood in scrotum. Hemangioma is basically congenital vascular lesion. Or it is a birthmark. Lesion or birthmark. Next, come to question number 3. Good posture is option A saves energy, option B aesthetically good, Option C, prevents musculoskeletal complications. Option D, all of the above. Here, the correct answer is option D, all of the above. Good posture basically aligns joint optimally, minimize minimize muscle effort and reduce ligament strain. Next, come to question number 4. IFT can be effectively used for the treatment of option A, stress incontinence, option B, sports injuries, option C, Raynaud's disease, option D, all of the above. Here, the correct answer is D, all of the above. Stress incontinence is due to pelvic floor muscle weakness. IFT is given to reduce the spasm in pelvic floor muscles, Raynaud's disease, to increase circulation, and sports injuries, to relieve pain and reduce edema. Next, come to question number 5. A person was playing volleyball. During the play, while smashing the ball, he got blunt injury on his right middle finger. It was too painful and he couldn't extend his last phalanx. Which is this deformity? Option A, torn finger. Option B, trigger finger. Option C, millet finger. Option D, mallet finger. Here, the correct answer is option D, mallet finger. Injury to in mallet finger, injury to extensor tendon at DIP joint, stacking flexion. Generally occurs in volleyball, basketball, and cricket. Trigger finger is locking during flexion. These are not identical terms. Next, come to question number 6. A 37 years lady recently become obese. She has developed symptoms of tingling, numbness, sensation, and weakness in thumb and index finger, with difficulty in holding objects in kitchen. You suspect positive carpal tunnel syndrome. Which test you will perform for clinical conclusion? Option A, phalanges test. Option B, phantom test. Option C, Phalen test. Option D, positive test. Here, the correct answer is option C, Phalen test. In Phalen test, wrist flexion for wrist flexion for 60 seconds, increase pressure in carpal tunnel, compresses median nerve. Positive results find tingling, numbness, pain in thumb, index, and middle finger. Next, come to question number 7. In interferential therapy for pain relief, a frequency of dash is used. Option A, 1 to 100 Hz rhythmic, 80 to 100 Hz rhythmic, 1 to 100 Hz constant. Option D, 15 to 40 Hz rhythmic. This is very important question and frequently asked in different exams. Here the correct answer is option B, 80 to 100 Hz rhythmic. Rhythmic basically prevents accommodation. 1 to 100 Hz rhythmic is for edema and reduce, exudate or remove exudates. 1 to 100 Hz constant or muscle stimulation, and 15 to 40 is for chronic conditions. Next, come to question number 8. A 38-year-old lady with rheumatoid arthritis comes to your clinic for paraffin wax bath and exercise. Due to chronic inflammation in finger joints, she has hyperextended PIP and hyperflex DIP. What is the name of deformity? Option A, dog neck. Option B, swan neck. Option C, butterfly. Option D, rye neck. This is a very easy question. This is swan neck deformity. Rye neck is a cervical condition. These are not an identical term. Next, come to question number 9. Majority of strokes are due to option A, cerebral infarction, option B, hemorrhage, option C, head injury, option D, idiopathic. Here the correct answer is option A, cerebral infarct, or it is a ischemic stroke. It spans about 80 to 85% of all stroke, and hemorrhage is basically 15 to 20% of all stroke. Basically, cerebral infarct causes due to thrombosis, embolism, or atherosclerosis. Next, come to question number 10. The physiology of force expiratory technique is based on option A, decreased followed by increased airway pressure. Option B, equal pressure point on the airway. Option C, change of volume of ventilation leads to increased pressure in the airway. And option D, none of the above. Here the correct answer is option B, equal pressure point on the airway. During force expiration, basically airway is equals to pleural pressure at a point. This actually helps to move secretion centrally. Next, come to question number 11. Man met with an accident and injured spinal cord at 5 level. After 24 hours, he has no reflexes, sensation, and voluntary motor activity. These findings are indicative of option A, a lower motor neuron lesion, option B, presence of spasticity, option C, decerebrate rigidity, option D, spinal shock. So the clear answer is option D, is spinal shock. Spinal shock is temporary physical shutdown of spinal cord. Occurs immediately after SCI, characterized by flaccid paralysis, loss of reflexes, loss of sensation, and autonomic autonomic dysfunctions. It can be lasts for days to weeks. Element lesion is basically localized, not whole segment. Spasticity appears after spinal shock, and decerebrate rigidity is according brainstem lesion. Next, come to question number 12. Stereognosis is option A, ability to recognize objects by feel and manipulation. Option B, ability to hear. Option C, ability to move joints. Option D, all of the above. Here, the correct answer is option A, ability to recognize objects by feel and manipulation. This is a cortical sensory function. Requires touch, pressure, and proprioception. Hearing is basically auditory cortex. Joint movement is motor function. Next, come to question number 13. A patient comes to your clinic with a history of fall from a tree and got hold of a branch with a stretched between turn and overhead arm on right side with a strong overpull on lower brachial plexus, CAT1. This is option A, Ab's palsy, option B, median nerve palsy, option C, Klumpke's palsy, and option D, radial nerve palsy. So here, this is easy question. Klumpke's palsy due to sudden upper traction on arm or lower trunk involvement. Ab's palsy is involved upper trunk C5 to C6, median nerve palsy involved wrist and finger, and radial nerve occurs leads to radial nerve palsy leads to wrist drop. Next come to question number 14. A full-time plumber wishes to discontinue physiotherapy and go back to work. He gets uh, workers' compensation benefits. Patient should not discontinue the treatment if she has pain which includes prolonged option A sitting, option B standing, option C squatting, option D walking on uneven surface. Here the correct answer is option C because plumber's job required prolonged sitting, kneeling and trunk flexion. Next come to question number 15. In a patient with osteoarthritis knee, the modification of toilet should be option A Indian style toilet, option B Western commode, option C bench toilet, option D bedpan. This is very easy question. B is the correct answer. Uh, Indian style toilet needs 130 to 150 degree of knee flexion, which is very harmful for knee arthritis. Bedpan basically is used for bedridden patients. Bench toilet is uncommon. Next come to question number 16. A patient with bilateral fracture femur and with head injury requires instructions for lower limb exercises. To plan the most effective teaching method, what should be most critical to assess at initial visit? Option A short-term memory capacity. Option B auditory and visual status. Option C comprehension of written, spoken, and demonstrated instructions. Option D changes compared to premorbid status. Effective teaching needs understanding, processing, and following commands. So here the correct answer is C. Next come to question number 17. All of the following statements are correct except option A impaired impairment leads to disability. Option B all impairment leads to disability. Option C relationship between impairment and disability is bidirectional. Option D some disabilities leads to impairment. Here the correct answer is option B all impairment leads to disability is basically wrong. Some of the impairment leads to disability. Actually, if you have lost your little finger, it can't actually affect your working capacity. So, it is not a disability. Next, come to question number 18. A patient calls therapist and complains of dull pain in the treated area of back, which is persistent for 3 hours following spinal mobilization. The therapist should option A refer the patient to the physician, option B inform the patient that this reaction is normal, option C add strengthening exercise in the home program, option D consider a possible neurological lesion. Here the correct answer is option B inform the patient that this reaction is normal. Basically, it's a post-treatment soreness, or post-treatment soreness is mild diffuse pain resolved within resolves within 24 hours. Red flag, you should remember red flags are sharp pain, progressive worsening, neurological symptoms. Next, come to question number 19. Conse- uh, Consequences of disuse of muscle in geriatric population is option A, increase in muscle fiber cross section area, option B, atrophy, option C, decrease in fatigability, option D, dystrophy. Here the correct answer is option B, atrophy, because reduced activity leads to reduced protein synthesis, right, which leads to reduce muscle fiber size, especially type 2 fibers, dystrophies, genetic condition. Next, come to question number 20. A pregnant woman wants to continue aerobic exercise. What is your advice? Option A, exercises in a water pool. Option B, exercises in supine. Option C, exercises in sideline. Option D, no exercise for after 5 months of pregnancy. Here the correct answer is option A, exercise in water pool. It will help. Water exercise provides buoyancy, reduces joint stress, improve circulation. Supine, vena cava compression, side lying, not an aerobic exercise for posture, not exercise outdated belief. Next, come to question number 21. A spastic diplegic child has bilateral hip and knee contractures. The best ambulatory device that can keep patient in upright position during walking is option A, an anterior rolling walker, option B, a posterior rolling walker, option C, offset crutches, option D, bi- uh, bilateral small base quad skin. Here the correct answer is option B, posterior rolling walker. Posterior rolling walker promotes upright posture and hip and knee extension. Anterior roller walker basically promotes flexion, crutches, poor stability, and bilateral insufficient support. Next, come to question number 22. What is the role of physical therapy in geriatric rehabilitation? Option A, bed-bound exercises. Option B, group exercises. Option C, maintenance exercises. And option D, postural exercises. Here, the correct answer is option C, maintenance exercises. In geriatric physiotherapy, the role of physiotherapist is to prevent fall, maintain independence, and improve quality of life. In answer key, the answer is given group exercise, but it is not the correct answer because it's very important to maintain the balance. The most comprehensive role in geriatric rehabilitation is maintenance exercise because it encompasses long-term functional prevention, which is central to geriatric rehab goal. Next, come to question number 23. In CBR, the rehabilitation professional mainly plays a role in option A, training, option B, providing medical care, option C, referral services, and option D, identifying handicaps. Here, the correct answer is option A, training. Basically, community-based rehabilitation empowers family, caregivers, and community workers and train them properly. Medical care is limited. Referral service is secondary. And identifying handicap is a shared role. Next, come to question number 24. Percentage of impairment in case of unilateral above knee amputee is option A 85%, option B 80%, option C 75%, and option D 70%. Here, the correct answer is option A 85%. Above knee loss is a major functional loss and it leads to 85%. Next, come to question number 25. Fine motor and function is option A grasp, option B pinch, option C proprioception, option D protection. Here, the correct answer is option B pinch, which is a fine motor or precision movement used in writing, buttoning, picking small objects. Grasp is a gross motor. Perception is a sensory segment. Protection is basically a reflex. Thank you everyone for watching this video. Please do like and subscribe to my channel and pin in the comment box if you find anything incorrect.